5 years ago is when I was first diagnosed with arthritis. I had acute pain, which was remedied easily with anti-inflammatories, and I didn't really notice much discomfort or pain in my hip, except for beginning to have a more limited range of motion in my yoga practice. Over the past 5 years, crossing my leg in one direction was always easy. The other way I had to lift my leg up. Now I can't even attempt to cross my left leg over my right leg. And fortunately, I'm not in pain, but discomfort sleeping. Last month, my knee is starting to bother me. I won't be able to do 2-3 hour hikes and go uphill, which I avoid now. The limitations I have, it's my lifestyle, and I'm really looking forward to getting back.
The ATHELLO hip replacement, which we perform here at Gotham City Orthopedics, it stands for Anterior Total Hip Equal Leg Length Operation. With the ATHELLO technique, we are able to manipulate the hip in such a way that we can operate through a very minimally invasive fascial window to perform a total hip replacement. Specifically, we cut no muscles whatsoever. We release no tendons whatsoever. The only soft tissues we divide are the hip capsule, which we have to divide to get into the hip to actually perform the total hip replacement. We then, after the case, repair the capsule, so there's very little soft tissue disruption whatsoever. That leads to far less bleeding, far less soft tissue irritation and pain, and patients can walk without assistive devices as soon as they're up from surgery. This is Miss Valerie Herzog. She's a 62-year-old young lady who had a direct anterior ATHELLO anterior total hip equal leg length operation total hip today. She will be going home today, same day total hip replacement in the surgery center. We're about 30 minutes out from surgery. I just want to show you, if you don't mind, Ms. Herzog, what we can do with this leg. This is the operative leg. Go ahead and lift it up for us. That's 30 minutes after surgery. She can lift and hold and do all types of amazing things. You can put your leg down now. This is her negative pressure dressing, and she's looking quite good. We're about to go over for x-ray, and once she gets up and walks around for us a little bit today, she'll get to go home. With the ATHELLO approach and procedure, we have the only device that allows us to protect the knee during the external rotation that has to be performed during the total hip replacement.
Dr. Henderson replaced full replacement of my left hip and anterior replacement. And it was hard to believe, and everybody I spoke to could not quite believe that it would be same day. They gave me a little direction on how to walk with the walker when I was there. I had relatively little pain.
The reason we can do this is with the ATHELLO procedure and technique is before or after surgery, these patients are not sick people. We're losing very little blood, therefore we do not have to check for H&Hs or blood studies after the procedure. The patients have very little pain, therefore they do not need IV narcotics after the procedure is done. They can immediately start their by-mouth narcotics and begin to transition home. Because there are no dislocation precautions whatsoever, there's no movement restrictions to teach the patients, or no physical therapy parameters they have to hold to, which would take days to teach them in the hospital. They can safely go home and sleep on either side of their hip and bend over any way they would like to without the risk of hip dislocation.
My name is Robert Hess, and I'm 80 years old. And I had a hip problem for 3 or 4 years, suffering, and I meet with Dr. Henderson, had a meeting with him, and we decided to perform the surgery. Went to physical therapy 4 to 6 weeks. I was back to normal, playing golf, driving an automobile, and again, absolutely no pain.
In hip replacement, using the minimally invasive direct anterior total hip replacement, using the ATHELLO technique, I believe we are at a stage of revolution in total hip replacement. I believe we are going to make the total hip replacement a far less intimidating, as well as a far less invasive procedure, that so much so that the standard of care will be that the majority of hip replacements will be performed in the outpatient setting, and the majority of healthy patients will be performed in the outpatient surgery center as opposed to the hospital in the near future.
The 6th day post-op, I'm walking without the cane. So it's amazing to me, and it's not me trying to do it, it's my body saying it's okay. I'm really listening to my body telling me what to do. I don't want to push it, but no other pain medication. I really don't have pain. Is it comfortable? No, but I don't have pain. They work me very hard at physical therapy. I'm very impressed with all of the exercises and all of the apparatuses that they have me do. It's really excellent. I feel well taken care of by everybody in every department. The surgical center was wonderful. Dr. Henderson is a total delight. And I'm really thrilled. I'm really thrilled. Can't wait to get back to yoga and do all the things that I was limited, have been limited doing. I'm so very aware of my range of motion. And I'm so excited to have my new hip work for me, as well as I think it's going to.